Hey everyone, welcome back. This has been a great day and I've enjoyed all these panels. Minneapolis is just a fantastic city. I live in Michigan and I really do care about the flyover states, and that term is offensive to me, and I don't really like using it, but it is definitely something that people use. So with that being said, thank you for watching so far, and we have one last panel for the day, and this is a pitch competition. So unlike pitch practice that we do every week on TechCrunch Live, there's a prize for this, and it's a competition. So we have 3 local Minneapolis startups presenting to 2 outside investors. But let me introduce these investors to you. So I'm going to read their bios, and then we'll introduce the first company. Okay. First judge, Mahati Sridhar, Vice President, Rise of the Rest Fund. Mahati is I'm reading something too, so I'm gonna look over here. Mahati is a Vice President on the investment team at Revolution's Rise of the Rest Fund. She joined the firm in 2021 and focuses on sourcing, due diligence, and supporting existing portfolio companies. Prior to joining Revolution, Mahati was an associate at Bull City Venture Partners, Durham-based venture capital fund, where she worked on seed and Series A software and internet investments in the Southeast and Mid-Atlantic. Mahati is also a Venture for America Fellow and served her fellowship in Charlotte, where she helped launch CFV Ventures, an early-stage fintech-focused venture fund. She started her career in investment banking at SunTrust Robinson Humphrey, where she worked on the healthcare coverage team. Next, we have Sarah Hinkfist, partner at Bain Capital Ventures. Sarah works with growth stage founders across both applications, software, and fintech. She's particularly interested in backing founders who have personal experience in the market they're creating. Sarah joined Bain Capital in 2020 as vice president on the tech opportunity team. Prior to joining Bain Capital, Sarah worked as an associate in KKR's growth equity group in San Francisco. Prior to that, she was senior vice president at Applied Predictive Technology, an enterprise SaaS company acquired by MasterCard in 2015. And I just learned she is from Wisconsin. Okay, well, Sarah, Mahati, thank you for joining us. The format for today's event is these companies have 4 minutes to present their companies with a pitch deck, and then we have up to 5 minutes to ask them follow-on questions. The first company going the first company going is Axion Athletics, and presenting at Axion, we have Jordan Johnson, founder and CEO. Jordan, are you here?
I am here. Good to go.
All right, fantastic. Well, you have 4 minutes to present your company, starting now.
I had made the decision to play college football. I made it about 3 days into fall camp. I'm sitting alone in my dorm room. I'm at my desk underneath my bunk bed, and I'm looking out across the room through the window. And in that moment, my vision started to go blurry. I started to sweat profusely. It actually felt like someone had taken a knife and kind of stubbed it right into my chest. And so I should also start by saying that I'm a firm believer in the power of sport. However, there is a dark side to it. So I ended up having a panic attack in the dorm room that day and inevitably stepped away from the team. However, I did return to campus a few weeks later with this new sense of curiosity. And what I really wanted to understand was this interaction between the mind and the body, specifically within the context of sport. And so really spent the next 6 years trying to do just that. Studied psychology. I joined the track and field team and eventually completed a master's degree in sports psychology. And if we could go to the next slide, please. One of the things that I quickly realized was the mental health crisis in college athletics. Now, research by the NCAA and other institutions have found that 1 in 3 student athletes experience a symptom related to a mental health problem. However, only 10% of these student athletes will actually seek out the professional help that they need. And so if we can go to the next slide, please. One of the things that we can see is it basically comes down to 3 factors. There's the mental health stigma, there's the burnout among the administrators within these sport organizations, and then there's the bottom line, the money component that really makes these barriers between student athletes and the mental health support that they need. And so we go to the next slide, please. One of the things that at Axon Athletics we're trying to do is we're giving athletes access to an online training dashboard. And so what does this look like? Student athlete goes back into their dorm room, they take out their phone or their laptop, and voila, they're into the application. Now, the primary way that they interface with the application is by completing AI-driven mindset workouts. And so what that looks like in the short term is using self-rated wellness data. How is your sleep, your energy, your mood, and using that to inform which exercises are specific to that individual. In the long term, though, that's integrating with more passive means of data collection, whether it's through like a smartwatch or relying on more sophisticated forms of machine learning and artificial intelligence. And so if we go to the next slide, please. One of the things that we're really trying to do in terms of tackling this problem is also offset the financial burden associated with providing mental health resources to all of these different sport organizations. And so basically, Axon's gonna be relying on two streams of revenue. The first stream is gonna actually be partnering with these given organizations on a subscription model. And so looking at anywhere from youth all the way up to Division I and kind of everywhere in between, but then also partnering with businesses in the community as a way to kind of offset some of that financial burden. And so what that looks like within the application to have promote adherence to training, athletes are awarded a certain number of points that they can use to cash in on certain offers. Now, these offers are going to be with businesses that we believe are like-minded. We're probably not going to have a liquor company advertising on our platform, more sport-oriented businesses. So if we can go to the next slide, please. One of the things that we can see from a market opportunity at $100 per student athlete price point, considering both the subscriptions from the sport organizations and the businesses, looking at about 57 million in ARR. And then that obviously expands to looking at all student athletes, and then all students at about 7.5 billion in ARR when we kind of tap into all students. So we go to the next slide, please. Now, as I stand here before you today, I'm very aware of the fact that in order to tackle a vision like this, I can't do it myself. I don't have the skills or the abilities, and really it comes down to building a team. And so we've started to assemble that small team, but at the end of the day, it really comes down to a vision, a village of people rowing in the same direction. And so I stand before you today just asking for feedback. What are we doing well? What are we doing wrong? And would love to answer any questions about myself or Axon Athletics. So.
Very good. Thank you so much, Jordan. Sarah, can we start with you, please?
Definitely. Thanks, Jordan, for sharing. I really appreciated your connection to the problem as well, and thank you for sharing such a personal story with us. My husband's actually, he was a D1 athlete as well through college and professional, and so I'm familiar with the challenges that you're describing in mental health, and it definitely resonates as being a really important space to find better solutions today. One question I had for you is, you talked about, as you think about the TAM or the market size, there's the price point, which you identified, and then there's also the number of people who would be applicable. And I'm curious if you think that for student athletes in particular, it's just a body that is better studied. And so that's why we have more statistics around the incidence of mental health issues, or if this is actually something that would be applicable to the entire student body, as you kind of talked about in the TAM slide at the end.
Great question. Great question. So based on kind of the research that I've done and the research that I pulled from other people, is in terms of the incidences of like mental health symptomology, the numbers are pretty consistent in terms of like that 1 in 3 statistic that I was sharing earlier. However, the one distinction between student athletes and just like the general student population is going to be the reporting statistic. So at that 10%, student athletes are going to be well below what the reporting statistic is going to be for more of the general student body. So to answer your question, I definitely still think there's room to apply something like this to all students. But at the end of the day, I do think that what makes student athletes different is that need or that desire to kind of report these different things, right? As athletes, we're taught to be tough, we're taught to be gritty, to fight through the pain, to pull ourselves up by our bootstraps. Exactly. And so when you kind of layer those two things together, I think it definitely makes it very challenging for student athletes in particular. So.
Thank you.
Hey, Jordan, thank you again for sharing your story. Much like Sarah, my younger sister is currently a D1 athlete, so completely understand exactly what kind of universe student athletes live within. I'd love to lean in a little bit more and talk about the student athlete lifestyle. As you alluded to, every second of every minute of every day is scheduled. And so even carving out time to practice this mindfulness and to spend time within this app is taking away time from something else that the student athlete would be doing. So how are you encouraging athletes to prioritize leveraging a tool like this?
Absolutely. That is a great question. So one of the things that we've really thought about or really kind of want to tap into is the competitiveness of student athletes, while also being conscientious of the time component that you're kind of alluding to. And so we're designing our exercises and the way that they interface with the application to be completed with anywhere between like 3 minutes to 5 minutes. So hopefully a short amount of time in what I view, and maybe obviously people can disagree if that's a short or a long period of time, and something that we hope to kind of figure out over the next few months here. But the other component in terms of the competitiveness piece is making access to like people simply completing the program available to like team members or organizations. And so what do I mean by that is looking at like, let's say a team level, you're working with a specific football team, for instance, how can we look at the team in total that says, okay, 90% of the workouts allotted for this team this week have been completed. We're not singling out individual athletes and saying, yes, you did, or yes, you didn't do it, but it's just a way to kind of say, okay, this particular team or this particular organization is kind of at this particular level in terms of it actually just adhering to that program. And so we think that could be very beneficial in terms of like between teams within a given institution, but then also hoping at one point to take it between like different institutions. How could, I'm from the University of St. Thomas here in St. Paul, how could the adherence to mental training in the St. Thomas campus compared to those at other institutions like in the Minnesota area, especially people within your conference? And again, just as a way to kind of lean into that competitiveness factor, as a way to really prompt people to want to do it more intrinsically, right, in that capacity. So
I got one question.
Yes.
Can you tell us about your traction?
Yes, absolutely. So the vision for Axon actually kind of came to bear a little bit too, and we developed a little traction last February, won the University of St. Thomas business plan competition and was awarded some seed money to kind of get things up and going. And since then have gone through a business accelerator program this last summer. And then currently I'm in another business accelerator program based here in Minnesota. And then we actually just launched our MVP last week. And so we're on board with a team, getting some things going. And then we have a few others in the pipeline that I won't put out into the universe just quite yet. But very much looking forward to kind of having those guys onboarded within the next month or so here. So
that was very good, Jordan. Thank you so much. We're out of time for you, but best luck to you. And I have 2 student athletes in my household, so thank you for addressing mental health and athletes.
Yes, thank you. I appreciate it.
Very important topic. Yes, absolutely. All right. Well, we're going to move on to the next company now. Next up, we have Daniel Larson. He's the founder and CEO of Kyros Care. Did I say that right?
Absolutely.
Yeah, great. All right. Well, Kyros Care. Well, you have 4 minutes to present your company, and we're going to start the timer now.
All right, so let's jump into it. My name is Daniel Larson. I'm the CEO and founder of Kyros. If you want to go to the next slide, let's just frame up the problem real quick. So we are a recovery management platform. So we work primarily or exclusively in the mental health and substance use disorder space, right? There's a huge amount of overlap, and so we touch on those things on a daily basis. So if you think about the 2 million people that are looking for treatment today that won't get it. We have about 65% of treatment centers saying that they're at capacity or turning people away. And you got a $53 billion market with no dominant technology player, right? And if you look at that number, that's not including the $32.5 billion in opioid settlements that are still racking up, about to be dumped into this industry as far as trying to solve a problem of not having enough people to help people that desperately need it. And that's at the core of our business. So what we do is we manage a marketplace. So if you go to the next slide, please. We've built a platform that essentially connects qualified individuals and trains people to become qualified individuals. And these are Medicaid and insurance reimbursable services. And they connect with people that they match with either demographically, life experience, and different types of backgrounds, either culturally specific or in other instances, to give them the best opportunity to get the help that they need. And so as a part of that, what we give is an individual provider the ability to skip brick and mortar institutions and have to work for a treatment center like the Hazleton we have in the backyard, or the Malibu passages that everybody's so familiar with, right? And they can go and become truly independent private practice substance use disorder treatment providers. And so what we do is we give them the technology to have EMR capabilities, find clientele, have ready-made insurance contracts, have malpractice, professional liability, general liability insurance all through our platform. They can log their hours, and then we pay providers once a week, and then we go and bill insurance, and then we take a percentage of that service fees. So a lot of the reason why we are so successful at what we're able to do is that we automate anything that doesn't have to do with actually helping people, right? So these are menial administrative tasks. So when it comes to enforcing charting notes or collecting user-generated data, or all of these things that really make for a distraction from the people that are suffering through this kind of devastating life problem, we automate that for the provider. So this increases their bandwidth, actually increases their billable hours as a service provider, and helps eliminate a lot of that administrative fatigue that they get. The other really neat kind of component of what we do is that we give people in recovery a pathway to become a trained provider, to then become insurance reimbursable themselves, and then turn them into people who make livable wage jobs on our platform. So if you're walking into a substance use disorder and you have just lost everything to an addiction, you actually have a program that forecasts out a year or two that says, hey, stick with this program, work with these providers, we'll give you training, and then we'll turn around and we'll have you help somebody that's in day one of their recovery. So it's got that nice network effect that we like to see out of marketplaces, but also these are people that have really limited their options based on some of their life choices in the past. So we can give them a very fairly certain outcome. So
all right, Daniel, we got to wrap it up here.
Oh, I'm sorry. Just go one more slide here. So basically, we're able to offer the full continuum of care. Hit one more slide, please. And we're able to offer a ton more providers per client, so our ratios are quite a bit better. We offer free training, and then we also can cut down an organization's payment about 50%. And so we can partner with organizations and providers alike. So sorry, I was not catching the full scope of the timer. I just saw double zeros the entire time, so I apologize for that.
No worries at all. You did a very good job. All right, Mahati, let's start with you.
Hey, Daniel, thank you so much for sharing. And this is a very, very like topical solution and space that a lot of folks in our country and families are dealing with. I'd love to lean in a little bit to the professionals and the providers that your platform recruits. What kinds of vetting goes into determining for these individuals to see how they're able to sort of like stand up and be, the professionals on your platform? And what additional training do you all provide for these individuals?
Yeah, so that actual vetting process is state regulated, right? So they have to go through a state regulated process. We have an approved curriculum, so they go through 46.5 hours of training to become a community health worker or a peer recovery specialist. And then we also have compliance and quality standards on our platform. So we have people monitoring different events, making sure that ratios are good, making sure that they comply with Medicaid standards. So we do take a fair amount of quality responsibility onto the platform.
Sarah?
Yeah, definitely. Thank you. Really appreciate it. Maybe switching to the other side of the platform, so not on the provider side, but on the patient side. Are you asking the providers to recruit their own patients, or is that part of the service that the platform or marketplace is providing?
Yeah, so one of the slides that we didn't get to is we're a B2B2C. So we partner today with about 42 organizations. We have about 870 clients onboarded to our platform as of this morning. And we have about 24 organizations in the pipeline. So today we have 23% of the entire peer recovery workforce in the state of Minnesota working on our platform at this capacity.
How are you prioritizing your go-to-market expansion, especially because many of your professionals have to be state mandated and state, qualified?
Yeah, this is one of our most tricky problems, right? And so what we do is we have a team that actually looks at compliance and regulatory environments, and we look for states that have reciprocity already with Minnesota. So we can go in and leverage our same technology. Our next expansion states, Arizona and Ohio. So we've already signed lease space in Arizona, and then we're opening up in Ohio as well in Q3.
And how do the economics for the provider compare to being on their own versus being on your platform?
Yeah, absolutely. So in this particular sense, they're only able to be a part of a group billing situation. But let's talk about medically assisted treatment nurse practitioners that also work on our platform that we didn't touch on. So they make about 25 to 30% more in our independently contracted. We carry all the malpractice insurance billing, but we also float the cash flow. So they're getting paid every 2 weeks instead of every 45 to 60 days from the insurance companies.
I'd love to talk a little bit about retention. So both retention from the provider or the professional side and from the individual patient side as well. So understanding a little bit about what that care continuum looks like. Is the same professional working with the same patient or individual on an ongoing basis? How many interactions are they typically having? And how do you incentivize that those relationships continue to grow and foster for better patient outcomes?
That's a good
question. No, absolutely. So right now they have an average of 2.5 appointments per week that adds up to about 5 hours of care a week. The professionals, we load up caseloads and then either through attrition, right? So you have to imagine in the space you have a fair amount of return to use, but we also have a fair amount of people that go into either peer recovery specialists themselves or graduate their programs. And so we measure retention based on the amount of caseload and ratios that they maintain. So then if they maintain their ratios, we can kind of monitor their caseloads. It's hard to ding them in a strict rating system, but we have actually a layer of clinical supervisors that work with every group of independent contractors, so they're not there by themselves.
Well, I think final question. One of the challenges with B2B2C is that you're managing so many stakeholders, and it can also be a source of opportunity for the network effects that come along with it. Which side of the market are you most constrained on today?
So it'd definitely be on the providers. There's about 12,000 open positions and there are providers to fill them. So what we've been doing is we've been cross-training in other areas to bring supply in adjacent areas. So when you think about licensed marriage and family therapists or people that are in the social work space, then we bring them into the mental health space and get them cross-trained.
Awesome.
Great answer. Well, that was really interesting. I didn't know a lot of that. Well, thank you, Daniel. Best of luck to you.
Thank you.
All right. Well, we have one more company today. We have Cathy Skinner. She's the founder and CEO of NXgenPort. Cathy, are you there?
I'm here.
Can you pronounce your company name for me? I'm sure I got it wrong.
No, you got it right. NXgenPort.
All right, great. Well, fantastic. All yours, Cathy. You have 4 minutes.
20 years ago, cancer came to my house. We all know someone who's been touched by cancer, and for me, it was my father. When my dad was at home and in between treatments, there was no way to keep track of changes in his blood cell counts and his vitals. Sadly, and on more than one occasion, my dad got an infection that landed him in the hospital and delayed his next chemo. Many years later, I was leading an exercise program for cancer patients. The patients were having the same problems as my dad, and I thought, there has got to be a better way. That's why we created NXgenPort. NXgenPort is the first of its kind implanted smart port that detects early signs of infection by measuring changes in blood cell counts, heart function, and vitals. The chemo port has been a standard of care for decades, and we added microelectronics to the port for remote patient monitoring. More importantly, we remove the barrier of patient-reported outcomes by creating a patient experience based on passive data collection. No action by patients is required. By monitoring patients remotely with optical sensors and machine learning, we help cancer patients stay on their treatments longer and provide physicians with the data they need for patient-centric care. 50% of cancer patients undergoing treatment suffer from low white blood cell counts that put them at a higher risk of infection and a possible delay in treatment, and even a higher risk of death. The consequence of this very common side effect costs the US healthcare system $2.3 billion annually. So how does NXgenPort work? We measure blood cells as they flow past our optical system in vivo, much like EasyPass captures the images of license plates of cars as they drive through a toll booth. The combination of blood cell data plus vitals like body temperature and heart rate create a novel data package that we hand off to physicians so they can take action. And these actions help hospital systems increase clinical efficiencies, manage their costs, and improve patient care. Looking at the size of the market, 19 million people around the world are diagnosed with cancer every year. 3 million patients are eligible for an implanted chemotherapy port. Our forecast shows a $750 million annual recurring revenue after 5 years of commercial launch. But why now? And why haven't port manufacturers done this? Port manufacturers see their device as a delivery tool, chemo in, blood out. We've reimagined the port as a passive data collection and testing device. We compete against wearables, which have very low levels of patient adherence and engagement. And one other competitor only measures vitals, and we capture those measures as well. Our novel features create an actionable data package by measuring blood counts and heart function in the body. We have a line of sight to our market and commercialization. We've submitted several patent applications, confirmed our FDA strategy for a 510(k) for the hardware and the software, and verified CPT codes for reimbursement. We have early traction. We're in a second year of a collaboration agreement with Mayo Clinic, and we've received investment from Baxter, MHub, and Edward Elmhurst Ventures in Chicago. Our go-to-market strategy focuses on licensing the technology to port manufacturers, and we anticipate commercial launch in 2026. We're in the midst of a seed round of funding where we're raising $2 million for product testing and continuing to build out our IP. Our team has decades of experience in medical device, research, and business. Our board is also industry leaders in medical device, regulatory, and patient advocacy. I like to think that if NXgenPort had been available when cancer came to my house, my dad would be here today.
Cathy, that was a well-rehearsed pitch. Thank you so much for that.
Thank you.
Okay, and you ended just right on, like literally the right second. Impressive. All
Thank
right,
you.
Sarah, let's go to you first.
Thank you, Cathy, for sharing and for your story as well. As exactly as you said, my mother-in-law passed away last year and had a port as well from cancer. So your stories resonate very much with our recent experience. I wanted to pick up, you were talking about the entrenched interests today. And so port manufacturers are just interested in chemo and blood out, as you described it. So after you commercialize or you actually have the device up and running, how do you plan to disrupt those interests to actually create the wedge of who cares to bring this to market to the patients?
Yeah, I appreciate that question. So I should be more clear. They've done very little innovation up to this point, but we're being courted by a port manufacturer right now who understands the value that for them to hold market share, they've got to start collecting patient data. So we've already made inroads into strategic collaborations, of course, the work with Mayo Clinic, the investment from Baxter, and some of those other entities. We're resonating very strongly in that field. And so we'll have to have a come to Jesus moment where we decide to either be a strategic collaborator or forge ahead on our own and develop our own manufacturing and sales and distribution.
A big pain point in healthcare is there's so much data, there's more and more data every day being collected, but there is such a disconnect with the different care providers and the overall care continuum.
Yes.
And so how are you thinking about the incredible pieces of information that the port will be able to provide, making it to the right physician and being an actionable piece of data that the provider and the patient can work with?
That's such a good question. And we think long and hard about that. And we speak weekly with a physician from Mayo Clinic, and it's absolutely our favorite call of every week. And we're looking at, on our side of the house, we analyze this longitudinal data between chemotherapy visits where we're pulling data 4 times a day that physicians have never seen before, but they're still humans and they still want that one actionable data point to come through the electronic medical record that they see, resonate, and they can make a decision about. So we're going to be owning that analysis of the longitudinal data, still interact with the physicians, giving them a concrete data point, a no go on chemotherapy or growth factor or blood transfusion or rescheduling chemo. So we know doctors are human too, and we're going to be catering to their workflow.
I'd love to hear more about how you think about the IP in the business. So to what extent does it start with the device itself versus the analytics on top and the data, and then the actual process that you're using to implement the data and the advice?
Great question. I'm very proud to say that NXgenPort holds all of our own IP, and we've filed 2 patents to date. The first one focuses on using optical sensors in the hardware. So we're taking port technology, optical sensor technology, miniaturizing it, customizing it, and this is my favorite part. I get to show you in the body of the port itself. And so the second patent we filed is on use case. So cancer, cardiac, renal, pediatrics, pharmaceutical manufacturers with virtual clinical trials, animals that are used for research, and animals that are suffering from cancer.
As you are thinking about your go-to-market, are you targeting any specific like therapy points or patient indications or types of cancer initially? And then how do you think about expanding that to all cancer patients or even beyond that?
So there are cancers that are going to be more adept and more find value in the smart port, for example, blood cancers, and then any cancer that a chemo port is indicated. And we're also thinking about cancer treatment that's an oral agent, but is so high risk that an implanted port that's monitoring a patient remotely would be of value. So, and please ask me that second part of your question again.
And how are you thinking about sort of expansion outside of potentially like cancer patients as well?
So we see opportunities to leverage our optical sensor technology and other catheters, whether they're IV lines, PICC lines, in diabetes care or in cardiac care. But we're starting with cancer because that's my story, my business partner, our chief technology officer. That's what resonates with us. So we're staying focused. And then, yes, we see significant opportunities to bring our technology to passively collect data for patients remotely, which is really the next generation of care.
I love your enthusiasm, Cathy. It's very infectious in
Thank
a good
you.
way.
Thank you.
Not in a bad cancer way. Yeah. All right. Well, thank you so much for coming on, Cathy. It was a pleasure to meet you. And to Jordan and Daniel, thank you again. So what we're going to do now is we're going to cut the stream here in a moment. And the judges and I are going to discuss the companies. We're going to take a look at them and judge them based on potential for impact, either financially or socially, and come up with a winner. In about a half an hour, I'll publish on Twitter and TechCrunch the winner of that, and the winner will get exhibition space and tickets to TechCrunch Disrupt in October. It's the best gift I can give them. I guess merchandise would be good too, but I don't have any merchandise. So with that being said, thank you so much for everything today. This last 2 hours has been a great deep dive on Minneapolis. It's a fantastic city. I would highly recommend it. So with that being said, thank you so much, and we'll see you next week.